I'm Wendy Fiumano, interventional cardiology nurse practitioner.
Good morning. Hi. Are you Lori? I am.
I see patients in the office mostly and also in the hospital. The physician will see the consults, I see the follow-ups. We go over test results, cholesterol. If they've had a heart cath, we go over the results of that. I started as a licensed massage therapist and I couldn't help enough people. I felt like the hands-on treatment was great, but I wanted to dig deeper and know more about medicine and treatment. So I went to nursing school to become a nurse practitioner. That was the main reason. And then most of my background was heart cardiology as an RN and then a nurse practitioner. My inspiration was not only digging deeper into patients' disease process, but also my father got sick when I was in nursing school. He developed a heart condition, and so I really started to study it then. I had one particular lady who came to see me, a patient, and she had these kind of odd symptoms. She was having a lot of leg pain, and she was pretty young female, very athletic, biking all the time, and this was a new symptom, extremely painful legs with exercise. Her symptoms were getting worse. I was concerned, and then she started having some chest discomfort. So I started doing testing right away. I looked at her legs, I started looking at her stress tests to check her heart, and lo and behold, she ended up having multi-vessel disease. She needed an open heart surgery, and she showed up probably 6 months later in my office. Of course, I remembered her, and she was just giving me hugs and crying, and she said, "I saved your life." Nurse practitioners are trained to be advanced. Providers, they can prescribe medications, they can diagnose and treat the same diagnoses that physicians. I educate patients, we have conversations.
Are you having any problems with your heart? Breathing problems, chest pain?
The biggest difference between myself and the physician is that I do typically spend a little bit more time in the room. I think the rewarding part is knowing that when you go home, you've really helped people. These are people in your community. These are family. We have a lot of family members, friends, and that you can be there for people, watch them get better.